Just right, there we go. So morning to everybody who is here. Good morning, everyone. And welcome to part 4 of Dementia Caribbean, 5 talks for the region. It's an honor to gather with professionals and caregivers who are passionate about improving the lives of those who are affected by dementia. I am Debra Callender. I'm the organizer for DC. I usually abbreviate it for Dementia Caribbean 5 talks. And I'm just going to make some opening remarks, and then we're going to get into the running order very quickly. So dementia is an umbrella term that it describes a range of neurological conditions that are characterized by decline in cognitive function that affect memory, thinking, behavior, and ability to perform everyday tasks. Alzheimer's disease is the most common form. It accounts for about 60 to 70% of cases. And other prevalent types include vascular dementia, mixed dementia, Lewy body dementia, Parkinson's dementia, and frontotemporal dementia, all of which involve associated with abnormal protein deposits in the brain, except for vascular and mixed dementia, which have a vascular component to it. In the Caribbean, dementia actually poses a significant health challenge. Recent studies indicate that the prevalence of dementia among individuals aged 60 and above is approximately 8%. Notably, the Caribbean has some of the highest prevalence rates along with Latin America, and figures reach as high as 11.7% in the Dominican Republic, 11.6% in Puerto Rico, and 10.8% in Cuba, that is above what we are tracking at 8%. So these statistics should underscore for all of us the urgent need for targeted health interventions and support systems in the Caribbean itself, within our region. This is one of the reasons why I stage Dementia Caribbean twice a year, because I'm trying to raise awareness and also to contribute to what we call brain health equity in the region. That is, I want to provide caregivers and professionals who are interested in dementia care with free, accessible information that empowers them to support individuals living with this condition. I believe that by sharing knowledge and fostering discussion, we can work together to improve care strategies, we can advocate for better policies, and create a more informed, compassionate Caribbean community. Today, we're privileged to hear from what I think is an incredible lineup of speakers who will explore innovative approaches to dementia care. We begin with Donna Singh, who will share insights on aromatherapy in dementia and its potential benefits. I will jump in and present on cognitive stimulating therapy, focusing on empowering caregivers with practical strategies. Next, we have Benedicte Mannix, who will discuss psilocybin. I always get this wrong. Psilocybin in dementia and the emerging possibilities of psychedelics in cognitive health. Sheryl Garriques-Lloyd, who is from the US School of Nursing, will highlight the crucial topics of mental health and the caregiver, reminding us of the importance of well-being for those who provide care for these people living with dementia. And last but not least, my fellowship evening scholar Offniel Lamont will close our session with a discussion on exercise, physical activity, and dementia, reinforcing the role of movement in brain health. For those who may not be able to stay for the entire session or who wish to revisit the discussions, the replay will be available on my YouTube channel after we've streamed this session. Please subscribe to the YouTube channel and to my other social media channels as well to stay updated and access this valuable content at your convenience. I once again want to thank our esteemed speakers for sharing their expertise, and I want to thank each of you for being a part of this vital conversation. So let's engage, learn, and continue working towards a better dementia care, better dementia care in the Caribbean. So I would love it if in the chat, everyone can share where they're coming from, and whether or not they have any, if you're taking care of someone with dementia, if you are just curious about dementia, etc., I would love it if you can share in the chat for me where you're from and why you're here this morning, if you want to. I'll give you a few minutes. Let me just give you a few minutes to add to the chat. Oh, dear, sorry. My sister's telling me the chat is disabled. Hang on a second. Let me see if I can remedy that. And thank you for all of the attendees who are here already. I see you and I'm coming. Let me just see if I can to do something in the chat so that you guys can share with me as I've asked. Hold on a second. Benedicte is telling you guys good morning. Give me a few seconds. Let me see if I can do. Okay, so you should be able now to use the chat. So everyone, give it a try and let me know where you're coming from. And if you're taking care of someone or anything else, you know, why you've come to Dementia Caribbean this morning. I'm always curious to know who my audience is. So give it a try. Morning, Lisa. I see you in the chat. Let me see if I can correct. Hi, Dwight. Welcome. Dwight is from Jamaica. Welcome to Dementia Caribbean. Tanya. Hi, Tanya. Tanya is from my support group. Tanya is, of course, from Kingston, Jamaica. Hi, Helene. Morning as well. Oh, lots of my people are in here. Karen. Hi, Karen. Oh, yes, you've been looking at, wow, for 8 years. Montego Bay. Hi, Audrey from Kingston. Leanna, who is in Discovery Bay and cares for her husband with vascular dementia. Karine, morning, Karine. Sorry, Karan, please forgive me. I'm sorry, his mom has dementia and you're also in healthcare, and that's nice to know. Dorrit from Spanish Town, welcome. And Charlene. Hi, Zethu. Zethu is from the United Kingdom. Dorothy is telling me her cousin has dementia. Jeff from the UK. Hi, Jeff, who has an elderly mom in Barbados. Oh, that's lovely to hear. Faye from Portland. And Raymond in Jamaica with his mom in Florida. Oh, bring her home, Ray. He says his mom wants to return home. Bring her home. Hi, Leslie Garcia, who's in Trinidad and Tobago. We're so happy to have Trinidad in the house. Hi, Leslie. Jamaica, all of my Jamaicans. Helen, who I know, who is in Canada. An anesthesiologist in Montego Bay. Sorry, the chat went too quickly there. And Dwight is Dwayne, who is saying he's happy to listen to today's lectures. He has a background in counseling and psychology. Yes, Dwayne, we need that a lot. Sheryl, and you'll find a wealth of information in Sheryl's talk. Hi, Devon from Spanish Town. And Claudette, who is a registered nurse. It's nice to see healthcare in here. Pauline from Richmond, Virginia. Hi, Christine. This is Christine is one of the people from my support group who is caregiving a friend, a real stalwart. Charmaine, hi Charmaine, also from my support group in Spanish Town. Teresita has raised her hand. Teresita, why did you raise your hand? But Charmaine, it's nice to see you. Let me see if I can allow Teresita to talk. Teresita, can you unmute and talk? Because I see you have your hand up.
Okay. Hello,
Hi, Teresita.
from Immaculate. I think you're familiar with Immaculate.
I am an old girl, actually, as I think you would know.
Oh,
So
yes. All right.
it's nice to have immaculate girls on here as well.
We
I
have
don't
some.
think you were my year. Were you my
No, I wasn't. I wasn't. I didn't go to Immaculate. But we have sisters here who have dementia.
year? Oh, yes. I know Sister Greta.
That's right. You come
Who
here,
I
don't you? You come here
Yes,
sometime.
I miss Sister Greta. I'm gonna come and bug her some more.
Please.
Yes, it is.
Yes,
I
please.
do. I'm aware. Immaculate's convent.
That's right.
Yes, some of the Franciscan sisters. I'm happy one of you could make it.
Thank
Um,
you.
so it is so welcome from this is the Franciscan one of the Franciscan orders in Jamaica. These are the nuns who have their convent at Immaculate. Sister, feel free to give the order's correct name.
Franciscan, yeah, Franciscan Sisters of Allegheny.
Right, the Franciscan Sisters of Allegheny are in the house. Thanks for hanging out with us, Sister Teresita. I'm gonna mute you now, and but thanks for raising your hand and introducing. It's nice to know they're here. I have a lot of love for the sisters. So Joan Martin, hi Joan from St. Bess. She has a brother with memory. Oh, that's interesting. That's interesting. Vilma. Yes, Vilma, thank you. She says my webinars are usually very helpful. Aw. We try. We do try to do that. So we have a couple more minutes. Anyone else want to tell me where they're from? And if not, but I'll wait a little bit more. Let me see if everyone else wants to tell me where they're from. But I'm very happy to see such a wide spread of people and also people from overseas and so on. We usually have people from the United Kingdom, from other islands in the Caribbean, and from Jamaica itself. I'm happy to see people outside of Kingston. Thanks, Chris, Lance Club of St. Andrew in Central Jamaica. Tamisha, who is from Kingston. It's lovely to see all of us here and how many people are interested, medical professionals, people who just have some, not just people who have someone caring about at home. Hi, Gavin, who is a senior resident, University Hospital in psychiatry. You'll find this interesting. Feel free to reach out to all of us. Otherwise, Gavin, this is a heavily psychiatric session. We have Dementia Caribbean twice a year. I try to have it in March and September. The last time we were heavy on policy. This time we're heavy on the psychiatric, I think, which I think will be interesting as well. So welcome. It's nice to see. And that's my intention with Dementia Caribbean, is that everyone, whether or not you're a doctor, if you're just someone at home with you, with a person living with dementia, if you suspect this person might have a dementia, etc., my intention is that everyone can gather in one place and learn more and become a community around dementia, because not everyone is interested in dementia, which we totally understand. But those of us who are need to sort of come together into a community where we can support each other. The last thing I'm going to say with the 1 minute I have left, everyone here should be aware that I also run a support group for dementia caregivers. It's online. We meet the first Thursday of every month. If it is that you're interested in that, you can always WhatsApp me. Everybody knows my number, but I'll say it again. 876-829-8200. You can WhatsApp me and say, hi, I'm interested in joining the support group. We'll make you fill out a little form and then you'll receive invitations to the support group. So for those of us who are here who are not in my support group already, just know that there is a place you can go online first Thursday every month and talk about what it is you want to talk about, including the things that I say are not, things that are not pretty, that we sometimes feel, and also to get help and have a compassionate community. Hi, Livingston Burnett from Jamaica. Have a community. Beulah from Kingston, who is a caregiver, former caregiver, but still giving support. It's important for us to know that there is a place we can go. So you can always WhatsApp me, 876-829-8200, and I'll answer your text, I'll answer your WhatsApp, I'll send you whatever the form is, and then you can fill it out and we can take it on from there. So thank everybody for telling me where you're from and participating. I love it when we have an audience that participates. And now I'm going to introduce our first speaker, who is Donna Singh. I've known Donna for a very long time. I suspect many people in this audience have known her, might know her as well. So Donna has over 20 years of experience in aromatherapy with a diploma from the Manchester School of Therapies in the United Kingdom. She's also a graduate of the London-based International Institute of Health and Holistic Therapies, from which she holds a practitioner certificate in stress management. A businesswoman, Donna owns Aromacare, which offers custom aromatherapy products and senior care services, which provides in-home nursing carers in Kingston. Sorry, guys, I've lost my individualized, sorry. So she provides, so senior care services provides in-home nursing carers in Kingston and individualized nursing home placement across the island, that is very well needed. So I'm always promoting Donna's services. She's also active on Facebook, LinkedIn, Instagram, and Blue Sky. So go there and follow her. Look for her name, Donna Singh. And she delivers value to her subscribers by sharing insights on aromatherapy and senior care. I can vouch for that. Donna's motto is supporting living in peace, grace, joy, and bliss. So I'm super proud to welcome Donna Singh. I am responsible for sharing Donna's presentation. So, so give me 1 second to share it. So that we can get started. So Donna, welcome. Everyone, please welcome Donna Singh.
Okay, thank you, Deborah, and good morning to all. Today, I'm going to be sharing the benefits and the uses of aromatherapy mainly to support your physical, your mental, and your emotional well-being. But I want to point out that these ideas are for the ones we care for and also for us caregivers. That is the sort of spirit of which I'll be presenting. So, what is aromatherapy? Next slide, please. By definition, it's considered a complementary therapy that uses essential oils extracted from various parts of plants and to promote, again, your physical, emotional, and your mental well-being. If you take like a rose petal or a lavender flower or a rosemary leaf, that's one of the oils we're going to be going into later, what you smell is the essential oil. And the essential oils have various properties. Almost every plant will have essential oils, and the essential oils have various properties. The oils are extracted by two primary methods. Steam distilled, like in lavender and rosemary and so on, or cold press, which is mainly the citrus oils like orange peel and so on. So once these oils are extracted, then we get into understanding the properties of the oils. And I should point out that the essential oils are considered the life force of the plant. That is where all the nutrients, all the things that will help us to use them to create, to heal, are contained in the essential oils. Next slide, please. The properties of the oil, that is a very important thing to consider, because all oils have various properties. So for instance, one of the key oils that we talk about is rosemary. And rosemary is, I would say, the #1 oil for things like concentration, your memory, and focusing, but it is also one of the main oils that we use for pain. And it's also very good to things like hair care, to add to your shampoo and so on. So the oils do have different properties. Another one could be like frankincense, which is probably your go-to oil for calming, relaxation, and it is also an excellent skincare. A lot of people use it for meditation. Then, of course, you have the oils for first aid. Tea tree is one, very popular one. Peppermint, antiseptic, antibacterial. So the oils, the key is to know how to create a blend where you're getting all the main properties of the oils. It's like a synergy then, right? And one term we use in aromatherapy is that the sum of the whole is greater than the sum of the individual parts. And that's a key to blending to get an oil for the condition that you're treating. I want to go through I guess, maybe the oils that caregivers would be mainly using. So we talked about rosemary earlier. For pain, one of the blends that I really recommend is a blend of rosemary, nutmeg, ginger, two real important oils for pain, with lavender. And there are different ways to use the oils. One way, of course, is to just sort of inhale it. So it goes through the olfactory system and goes to the limbic brain. The more popular one, though, is to use topical, which is just massaging, rubbing, and later I can show you a sort of a short demonstration. And it doesn't have to be a full 1 hour body massage. 5 minutes on the hands, or just the shoulders, or the head. The head is a good place. It's an Indian head massage that is really effective for calming and to relaxing. So we've gone through the properties of some of the oils, and I want also to stress that the oils you can use in your daily routine. It doesn't have to be a special occasion. It can be incorporated in just your normal life. And if, for instance, say the person is not able to sleep, 2 drops or lavender on maybe a coffee filter into the pillowcase, and I guarantee it would definitely have some effect, and it can promote restful sleep. So these are some of the things that we can use to kind of get an understanding of how we can use it every day. Pain is another one we've dealt with before, and if the knees, the palms, and the shoulders are good places to totally do a quick massage, and I find very effective.
Should I move this slide?
Yes, please. Yes.
Okay, poor Donna.
Sorry?
No, I was saying poor Donna because I was like, wait, should I move this slide? And then I didn't want to interrupt you because you're giving so much good stuff.
And then I'm forgetting to tell you. Okay.
But that's great.
So back to how to apply it. We did inhaling, and I'm going to show you like a very, which I find a very effective way. Again, we don't need to spend an hour. It can be 5 minutes. So if you have your blend, I don't know if you can see. If you have your blend,
I can see, yes.
Say it's a relaxation thing you're trying to achieve. Blend it up with your oils, and you always for the oils, always use a carrier oil. It's not recommended that you apply the oils neat on the skin. You should really use like olive oil, coconut oil. I like sweet almond, and the ratio should be like 15 drops of oil to 1 ounce or 15 ml of carrier oil. That's the typical ratio. And if you just take your thumbs, rub your hands with the oil, and you just press, slide, press, slide, press, slide. And then you do your fingers individually, fingers, other hand, same thing. All right. And press and press, and each finger. And then, of course, you're having contact with the person also, so you're relaxing them. For the Indian head, it's simple. It's just to just take your fingers again, press, press, circle, circle, pull the hair.
Is that on the top of the head only? When you press that circle, is it just at
No,
the top?
all over.
All
Yeah,
over the
all
head?
over. Yeah, but
Oh,
but the
that must
idea
be.
is to press and circle, press
Oh,
and
yeah.
circle.
So
Yeah. This is
thumbs and fingers. Oh, this
yeah,
is nice.
when I used to do massage, this was a very, very popular, effective way to relax someone.
Yes, you should try this. This is really nice.
Yes,
I
yeah.
might go to
And of
sleep
course,
here. Press your
of
thumbs in
course,
Benedict. Oh my gosh, this is nice.
and of course, you're using the appropriate oil.
Yeah, no,
You
if
know,
you, oh, nice.
right?
That's nice. I like that idea. The Indian, what's it called? Indian head?
Indian head.
Okay, it's very
It
nice.
also, by the way, it also promotes hair growth.
I
So
can
it's good if you
imagine
do.
because I love how it feels on my scalp. My scalp is always a little bit tense and tight, and this is really nice. Just making small circular movements with the fingers, oh, with a little bit of pressure. Benedict is really,
Right.
it feels nice.
And
It's
also you can pull
relaxing,
the
it's
hair.
stress alleviating.
Yeah, it is. That's a great tip, Donna, because it's a lovely move. I can feel the difference
And,
just from doing that.
yeah. And
Oh,
what's good is that you can do it to yourself.
yes.
It's for
Caregivers,
you.
you
It's
listening?
yes, right? No, to me, it's one of the most short relaxation methods I can think of.
That's
You know,
lovely.
of course,
That's
and of
lovely.
course the neck and shoulders and so on. Let's see now. Okay. Um, some little do's and don'ts. You may see what is called aromatherapy oils, but they are
Yes.
in fact fragrance oils. And there is fragrance oils do not have essential oils, and they are not in any way therapeutic. They make nice, I guess, air freshener, air whatever thing, but they're not essential
They're
oils.
not
Essential,
therapeutic at all. No.
not in no way. I mean, they smell good. You may see some people in the car, they have the air freshener, or candles. And the way to tell pure oils is to actually buy from a reputable place. It should have the botanical name if it's a single blend, and also price. It takes over 100,000 rose petals to produce half an ounce of oil. That is a pure essential oil. So if you see a rose oil for a couple hundred, it's likely not rose oil. So the idea is and I would recommend that if you want to use aromatherapy in your daily life, and first aid, great first aid way, and get a book, or go on the internet and read up on basics of what essentials are. I would, to summarize, I would say use it in your daily, everyday life. Add a couple drops to your bath, relaxation, frankincense, sandalwood, always lavender, number one go-to oil for that. Hair care, and also if you want to, for concentration, definitely to stimulate memory, and skincare, there's geranium, there's again frankincense, and also if you want the uplifting oils, tend to be like ylang ylang, orange. Orange is a sweet orange is an excellent oil.
And
So there are
peppermint
many.
is good for alertness too, I think.
Sorry?
I
Yes.
said
Oh,
I
yeah.
think peppermint is good for alertness. Sorry, guys, to be interrupting you during your talk. I promise not to do this to the other speakers. But it is. So, Donna, I want to thank you. Don't move. I want to thank you for summarizing all of that for us. I hope everybody, because that Donna has given you like so many gems in a short period of time, because she's given you, I'm just going to skip back over her slide. She's given you that how to apply it, for how to mix it for topical application and for inhalation, the 15 drops and the 8 drops, right? If it were me, I'm just gonna say, because Donna runs Aromacare, and Donna is someone that she again is very easy to get in touch with. I'm gonna ask you, Donna, to drop your, well, what you might want to do is recite it, and then I'll drop it in the chat, your contact info, but not as yet. Donna runs Aromacare, so she does mixes, on request, and also she can make recommendations and create blends for you, right? I use Donna's stuff and I stand behind it. I would really recommend her for that. I personally think Donna needs to do a course, and I'm gonna see if I can help you with that, where you kind of run through and teach people how to make blends. Because I think, as you said, just how you said, the sum is greater than the sum is of the whole is greater
The
than
sum of the
individual
whole is greater than the
and the
individual.
individual parts.
Yes.
When you learn how to blend them, which is done a skill. So sometimes on our own, and there's nothing wrong with this, I tell my caregivers all the time, integrate sense into everything you're doing with the person. So when they're bathing, as she said, when they're sleeping, so that especially for those of us who we might have some people with agitation or who are a little bit restless, and she's given you like a couple of scents that you can use, the rosemary, which is alertness, peppermint as well, the geranium and lang lang. I'm just skipping back over the slide. So now I'm going to stop sharing. Donna, thank you for that. I'm going to stop sharing. Lisa is saying, oh, it's so useful and informative. Shoba is saying, I would be interested in joining the course. Me too, Shoba. Believe me, we're going to make Donna do that this year. We're going to hold her accountable this year for that. Because I think it would be especially good for caregivers to learn to do it, so that they're more confident doing it. But Donna, you just gave us a whole lot of stuff. Thanks, Charmaine. Yes, I know you'd be interested in it as well. The best, Benedict goes, thanks very much. Where's the best place to buy essential oils in Jamaica? Donna? And everyone, this is question and answer time. So if you have questions for Donna, put them in the chat. Go ahead, Donna.
I would say, again, reputation, health stores, but
Can
check
they buy them
always.
from you? Can they buy them from you, or you
Not
don't do it?
I do blends. I create blends. I have a product list, including for concentration, relaxation, skincare. So I have that. But when it comes to single oils, I tend not to go there. But if you're buying a single oil, just read the label. Make sure it doesn't say fragrance oil. And again, a recommended price. An orange oil would be like a fraction of the cost of something like rose jasmine. Jasmine is probably the most expensive oil in the world. So reputation, I think.
So So would you recommend would you call any names in terms of where we can go in Jamaica to find really good oils?
Well, I'm familiar with the Ligoni area. There is Organica, which is in what's that plaza there? Whoops, across from Burger King.
Oh, Orchid Patch, I think it's called. Organica in Orchid Patch.
Orchid, yes, Orchid Village. They are good. They have, they have.
They
I
have
would,
reputable oils. They have good
yes,
oils.
yeah. When it comes to blends, I do blends, and I actually have a product list of the various oils for,
Yes. No,
you
I
know.
need to, guys, I will look for her product list. Because they're asking for your product list. Anna is saying, hi, Anna, Dr. Brown Morgan, one of my favorite GPs. She's saying we need a brochure on how to blend and mix if we're to learn to use it regularly. And that's why I would say a workshop, Anna, because what I would say let her do the practical workshop where you actually do it and you rehearse it, and then she can give the handouts and so on. Because it is, I am someone who I find I have to do it myself to kind of get, to get the feel for it. And then we could hand out the varieties of stuff and stuff. I think it's a great idea. I think it's worth pursuing. Judith is asking for contact for you, Donna. Can you give a contact for
Oh,
you?
sure. I WhatsApp phone number 876-461-9162.
9162.
And I mean, I'm always available.
I'm just putting it in the chat for you.
Right, and my email is singhdonna@yahoo.com. One word.
And anyone who doesn't remember all of this, you can always reach out to me and I'll give you Donna's information as well. And the same goes for all of the speakers.
Yeah.
If you don't remember everything we said today, or if we're talking too fast and you can't write it down, everybody can reach out to me, 876-829-8200. I'll give you the contact information for all of them. I put the contact information I had on the bottom of the emails that were sent out. So if you look back, you should also see their information at the bottom of the emails. But I'm totally happy to give everybody the contact info they need. So don't feel ashamed to read. Don't be like, oh Lord. You can reach out to me, and I'll give you the information if you didn't get that. But Donna's info is in the chat. Stacy Nolan, welcome. She's like, we need a product list and a workshop. I would be interested. You see that I'm making the money here.
Thank you.
And Sheryl is saying that her product list is on her Instagram. And her Instagram is Aromacare JA. And that's in the chat as well. So if you look at Aromacare JA, her product list is there. I have a product list from Donna as well. So post this, I'll see if I can send it to all the attendees, so that you can see our product list as well. I make a note of that before
I want to add, Debra, I also have brochures that explains from, how to use the oils and, with recipes.
So Anna, you're right. She does already have a brochure that you can.
Yes, I have quite a few.
No, that's good. So then I can forward one of those to Anna because she asked for that specifically, Dr. Morgan.
Definitely.
So, yeah, you're welcome. It's my pleasure. I'm so happy to have you here. You can't know. So I'm totally pleased to have Donna with us. I've been begging her for quite a while, and she's like, oh, but Donna was busy doing other things. But I am happy to have her. So thank you, Donna, for that.
Thank you.
And thank you for being here. I am next up, I believe. So give me 1 minute and I'll open my talk. If anyone has any other questions for Donna, feel free to still leave them in the chat. Doesn't mean that we won't, because I'll try and get as many of them answered as I can. Okay, let's see. So here I am again. Right, and we're gonna talk today a little bit about cognitive stimulating therapy. So for everyone who doesn't know me, which is, I'm not sure who doesn't know who I am in this chat, but in this audience, but my name is Debra Callender. I am a registered physiotherapist. I hold a master's in dementia studies from Brighton and Sussex Medical School in the United Kingdom. And I am a physiotherapist and a dementia care specialist. So being a dementia care specialist covers a whole lot of ground, right? There's many, many things we do. We assess the person for their needs, and we also work alongside the caregiver, and we also work alongside the person living with dementia themselves. I have to admit, I'm kind of very passionate about the person living with dementia themselves. I wish that we had better early detection in Jamaica, because I think a lot of us, sometimes we know we might be having some difficulties, but we're sort of still putting off going to the GPs and saying, listen, I really have this concern around my memory. And if the earlier that we are able to catch you, is the earlier that we're able to put you on medications, but it's also the earlier that we're able to do interventions like this, which I'm going to speak about today, cognitive stimulating therapy, that help to help to delay the progression of the dementia itself. So I say it everywhere I go, and I'll continue to say it. If you have any questions about memory loss, if you have any questions about you being able to organize tasks, if you find yourself suddenly struggling with things that you never used to struggle with before, reach out to your GPs, reach out to your neurologist, reach out to your psychiatrist and say, I am having these difficulties, because as I said, the earlier that we know, it's, dementia, we can begin to put things in place to delay the progression and to prolong the quality of life, that you have. So consider it today. If you know anyone who's having issues, don't wait. Don't say, let me see if it's just whatever. Really go and talk to your GP seriously about it. If your GP is not really, if they have tests that they can run, if they don't run them, maybe you ask them to refer you on to a neurologist or a psychiatrist so you can get the assessment you need and get the management that you need, okay? Because it's really important for us to understand that we need to manage our cognitive health, okay? And dementia is not the only time we need to be concerned about our cognitive health either. All of us need to be concerned about, are we taking care of our brain? Are we protecting our brain? Are we eating what's good for our brain? Are we managing our medications and so on, so that we are optimizing our brain, and our supplementation as well, so that we're optimizing our brain function, okay? So one of the things that I do, and we'll soon start to teach our caregivers to do, is cognitive stimulating therapy, okay? So what is cognitive stimulating therapy? It's a structured evidence-based intervention. It was designed to enhance cognitive function in individuals with mild to moderate dementia. Now, for those of us, when I say cognitive function and you're like, what on earth is that? It's not just memory, okay? It's attention, it's the ability to organize tasks, it's the ability, so recall is one thing, memory is one thing, but we also have to be able to pay attention. We have to be able to organize tasks. We have to be able to have verbal selection, the ability to select the right words and to use them appropriately. And there are other aspects, or what we would call domains of cognition as well. So I don't want you to think when I'm saying cognitive function, I'm only talking about memory. If you're struggling with any area of functionality that you weren't struggling with before, you probably want to have a chat with your GP in terms of whether or not you're developing some cognitive impairment, not just memory, okay? CST, which is what I call it and what we tend to call it as an abbreviation, cognitive stimulating therapy, it was developed through research, and it's endorsed worldwide, everywhere, Africa, Asia. I worked a lot with CST when I was doing my master's, because it is the foremost non-pharmacological intervention that is used, so non-drug intervention that we use when we come to work with people who have cognitive impairments or dementia itself. And I just want to draw attention to the fact that we use it with people who have mild to moderate dementia. In that heading, people who have cognitive impairment, mild cognitive impairment, you also fall into that category, even though I didn't put it there, okay? So it was developed through research. All the most Alzheimer's societies endorse it. So does the National Institute for Health and Care Excellence, which is the NICE, which is out of the United Kingdom. It would be the equivalent of the National Institutes of Health in the United States and so on. It's really one of the governing bodies that makes recommendations on what is the gold standard for healthcare in the United Kingdom. It was originally developed by Dr. Amy Spector, who is out of UCL, University College of London, and her colleagues. It was a collaboration, and it was developed with that intent to create a combination of the currently known non-pharmacological interventions. What CST has done is combine it into one place. So you guys might have heard of things like reminisce therapy, or you might have heard of, saying let's use exercise as an intervention, or let's complete puzzles, let's learn a foreign language, let's challenge ourselves with unfamiliar activities, etc. All of these things are approaches. What CST does is it combines all of those into one program. So you don't have to be like, okay, well, today, CST gives you the whole format, and then you can practice out of that format and hit all of the various interventions that improve cognition, all of the various non-pharmacological interventions that improve cognition. Typically, it's done in small group settings. I do it individually, and it is because of our COVID restrictions and so on, I have not expanded into groups, because we all know that older people are also more susceptible to COVID, and we do have those concerns still in Jamaica, unfortunately. Not to mention the flu season we're having. But typically it's done in smaller groups, and the aim is really to improve the various things, the various domains and areas, memory, problem solving, language, and to give you a bit of social interaction, either with myself as an individual or with a group when we evolve it to that stage. Typically, it was delivered in 14 sessions over 7 weeks. It can be done over 14 weeks. I have had the pleasure and privilege of interfacing with Dr. Spector and a lot of her colleagues myself, and they admit that it was 7 weeks because it was the time they had. I find that in Jamaica, I find older people don't really want you to be bothering them twice a week like that, so I space it out a bit more, which they said is fine, and we do it. So it's 14 structured sessions over 14 weeks is how I do it, so that I'm coming in once a week to you, not twice a week, to do a session, because I find a lot of our Caribbean elders, they find it a bit overwhelming to have to see you twice a week. Each one of these sessions, it can last between 45 minutes to an hour, and that is based on tolerance for the person. Some people, especially when you first come, they can't really sit with you for an hour and pay attention for an hour. And so you have to kind of, take what you can get and then progress it as they improve, because they do improve, okay? And I've put here the kind of activities. Oh, sorry, my camera dropping. I've put some of the activities that we use, discussions, puzzles. So I will bring controversial or very strongly worded articles and stuff, things that are not, so not just let's talk about the weather, right? Things like that might be about gender, things that will stir a reaction in people, and then we'll talk about those articles. We'll talk about the person's views on things. You'd be surprised where you can go if you're willing to have a discussion with a person living with dementia. These people still have such a wealth of knowledge and information, And it also helps them to sort of make connections with things based on what the topic you're talking about that day. So we do discussions, we use puzzles, we do word games, we do creative tasks, we do reminisce therapy. All of this is in structured ways, right? And the sessions usually have themes. So it might be childhood, current events, practical problem solving. We might have a session on something like food, and that might involve talking about food and then maybe touching some foods, or maybe creating a dish, or talking about what their favorite dish is and whether or not how they would cook it, etc., etc. And what we're focused on is engagement. They should be involved, so it can't just be me talking. They have to enjoy it, right? And it has to be done in a way that boosts their confidence, because a lot of people living with dementia have learned that they don't, no one is interested in what they have to say, and maybe they're not making sense, or by other people's definition. So they don't really want to speak up, and it takes a while sometimes for them to build back their confidence to really have a conversation with me as a therapist, okay? So, and which I've mentioned already, this whole approach can be adapted for individual sessions, right? So the evidence and benefits of cognitive stimulating therapy, we've already said, and these are all proven in research. And on the next slide, I'll show you the research underpinnings of this. So CST is known to improve cognitive function. It is actually to the level of the first generation dementia medication. So someone on donepezil, in research, they have been proven to have similar results using cognitive stimulating therapy. It significantly improves cognition, communication, overall well-being. And again, this is in individuals with mild cognitive impairment and mild to moderate dementia. It enhances the quality of life and their ability to interact, social interaction, boost self-esteem, and it has been shown to reduce depression and anxiety in individuals with dementia. And it is most importantly, and why I am most interested in CST and non-pharmacological interventions, is because it is very cost effective as an intervention. CST can be done very cheaply. It doesn't require you to run out and buy a whole set of equipment or anything fancy. You can use what you have at home. Or you might have to buy like one puzzle on Amazon or two puzzles on Amazon, which are like, over maybe $10 each. So it is not an expensive thing. We can train so that caregivers can deliver it. But it does require training. Not a lot, but it does require it. So it's an intervention that I hope we can begin to spread in Jamaica and the Caribbean. Because I do it with people living with dementia, and it does improve even in our conditions. It does improve their cognitive function by, it's usually between 1 and 2 points, which brings me to the next slide. So this is some of the research evidence for the fact that it improves cognition. For example, there was a systematic review done in 2012 by Woods et al. That's a very well-known review for those of us in the dementia field. And it found that CST significantly improves cognition, communication, and overall well-being, which is really, really important for individuals with dementia. Where there is not well-being, you are going to have behaviors that you're going to find very challenging as a caregiver. If they don't feel comfortable, if they don't feel engaged, if they don't feel happy and loved and comfort, you're gonna brace yourself, because you're gonna have the behaviors. So overall well-being is a really, really important goal for those of us who work in dementia care. And CST has been shown in research to make marked improvements in that. It is as effective as medication. Studies dating back to Professor Spector's own in 2003. And there are many studies going forward done by NICE itself and by other researchers suggest that CST participants show cognitive improvement of 1 to 2 points. On MMSE, our mini mental state exam, is one of our ways of assessing cognition in dementias. And this improvement of 1 to 2 points is similar to the effects of dementia medications like donepezil, as I've said already. And also it improves, it's been shown in research as well to improve quality of life measures by 2.7 points compared to control group. So in people who didn't do the intervention, the people who did do the intervention improved by 2.7 points. Now, let me just say something here because I'm very conscious of our culture in Jamaica. Okay. Just because CST is as effective as medication does not mean that we stop taking our medications. Okay. In practice in Europe, what we do, and in the United States, what is done is we take our medications and we do the CST alongside the medications. That's for the best, that's for to have the best result. So please don't throw the medications in the bin and say, okay, great, we're all gonna do CST. Yes, we can do CST. I would love for us all to do CST with our persons living with dementia, but the medication is important. And a lot of people will also say to me, oh, you know, I don't think the medication really makes any difference. It does. It might not be a dramatic difference, but it also makes a difference in the challenging behaviors. There's a lot of research that says that dementias who are not correctly medicated are more prone to having episodes where they have challenging behaviors, although we know that 90% of dementias are going to have challenging behaviors at some point. We do want to stay on the medications because that is part of the strategy for not having, you know, this continuous challenging behaviors, okay? All right, so let's look at what we're hoping to, where we're hoping to take things like CST, right? All over the world. We're hoping to do things like incorporate them into community centers, care homes, and home settings, that is being done already. Lots of my connections on LinkedIn are involved in that process of deploying CST in care homes and community centers and so on, so that everyone has access to it, because as I said, it's a fairly cheap intervention that really everyone, you know, can do. We also have digital adaptations. We can do it virtually, and there are some apps that are being developed, although I haven't seen them yet. I haven't seen a fully developed app as yet, except for there is one that when I had the first Dementia Caribbean, there a lady who presented at the first one. She has a fully developed app called Cosmo. And you can go back, look on my YouTube, you can go back and find her and get in touch with her, or I can get you in touch with her. She does have a functioning app for CST. We also want to combine CST with things like physical exercise, music therapy, and personalized medicine, which personalized medicine is about, you know, assessing the individual and only using the interventions that are relevant to that individual. In a way, a lot of us do that already as medical professionals. And then also cultural adaptations. A lot of researchers are adapting it to different languages and cultural settings, including me. The original CST has a lot of British markers in it, which wouldn't be appropriate worldwide. So you have to change them out to use things that are more relevant in your setting. Okay, so thank you for listening to me. I hope you learned something from my talk. And this is my contact information. I'm gonna say again, for everyone who wants to get in touch with any other speaker that is on these talks, you can get in touch with me at any of these things. I am best caught on WhatsApp, I'm gonna be honest with you. So if you message me on WhatsApp, I'll put you in touch with anyone, and I'm always happy to answer questions about cognitive stimulating therapy, doing cognitive stimulating therapy for your families. And as I said, this year we're gonna do coursework. We're gonna do courses so that we can teach, like 2-hour, 3-hour coursing, so that we can teach how to do CST to caregivers who, you know, are looking for an option. Okay, so does anybody, really quickly, does anyone have any questions that they want to ask me? Let me stop sharing my screen. Shoba says, reach out to the mental health officers and mental health nurse practitioners. Oh, yes, we've been doing that. Meditation is actually part of CST, Shoba, as well. So thanks for putting that in the chat. So that I wasn't able to give you every single thing that's included in CST, but meditation is actually a part of it. I love that part because it's very interesting to watch people have to slow down sometimes, probably for the first time in their life. But that is part of cognitive stimulating therapy. So thanks for that. Can any of this be included in a patient visit at an office? I would want to think it could be. Yes, because I could do it in an office. So if I could do it, I could train you to do it in an office. All you need is the materials. Once you have them in one place and the person is comfortable, the problem is when you have to move a dementia from place to place, sometimes they get very agitated and restless. So I go to their home to do it because they're already comfortable, they're already relaxed, and then we can bring on some enjoyment. But I am giving thought to maybe doing something through Senior Citizens Council, etc., where we can look at how we do groups. Because it would be nice to do groups so that people who are living with dementia get to meet each other. The only constraint there is that, we do have COVID and we do the precautions and so on. It's very difficult to implement with a person living with dementia. They can't remember to leave on the masking, and it sometimes contributes to agitation and so on. Is there any other question? Because I'm 1 minute over time. I know Benedicte, and I'm coming. Benedicte is such a sweetheart. She's like, no. So thank you guys for your questions. You guys are really interactive this time around. I am loving it. Yes, Anna is sharing with me that they come in with caregivers every few months. Yes, you and I can discuss that. It would be nice to add that on when they come in, and we can maybe do some stuff. Bye, Tanya. Thanks for coming in as well. Tanya said me she's stepping away. All right, so moving right along, we are moving to Benedicte Mannix, who is our next presenter. Thank you, Benedicte, for allowing me to sort of take up a bit of your time. I'm super grateful for that. Let me just find her introduction really quickly, because Benedicte is impressive. I'm really, really happy to have all of these speakers here. They're all so impressive. So Benedicte is a holistic psychedelic therapist who is dedicated to helping clients overcome challenges like anxiety and depression, using a unique and specialized protocol that treats childhood trauma, and it integrates her extensive knowledge of therapeutic practices. With over 30 years of personal experience with psychedelics, Benedicte has spent the past 15 years working as a psilocybin therapist, supporting individuals through transformative experiences. Her signature approach, which combines client-centered therapy, transgenerational therapy, somatic therapy, meditation, and mind-body techniques, fosters healing and self-discovery. Benedicte is committed to helping people heal and transform their lives, empowering them to reconnect with their true selves and achieve lasting change. So everyone, please welcome Benedicte Mannix.
Hi.
Go ahead, Benedicte.
Good morning, everyone. And
I can hear you. Yes.
I would like to thank Debra first for welcoming me today and letting me share about my domain of expertise, that is like psilocybin. So let me share a presentation. There. Yeah. So yeah, so today that we are going to talk about how psilocybin is can help in a holistic approach to help people with dementia. And of course, like we say, that people also helping people that, yeah. So we're gonna have like to talk about many things, but I'm trying to go straight to the point and not go in depth with many things. I think that you're gonna be able to have this presentation. I will let it available to everyone. So to not overload you with a lot of information that maybe psychedelic and psilocybin is something like pretty new for you. So introducing dementia, like we've already said about, it's the condition that is becoming more and more prevalent everywhere in the world. And the soonest it's been taken care of, it helped to delay the progression. And one of the 5 major factors that have been found in research is depression and anxiety. So that's what we're going to focus on. And I will just focus like on mainly on what psilocybin, the symptom that psilocybin can alleviate in dementia. So yeah, so the impact on patient, and that, like I said, that the one that psilocybin, where psilocybin can play a role on it, is cognitive decline, behavioral symptom, and reduced quality of life. And I'll go back like more in detail on everyone, and definitely the caregivers. I've noticed that most of all the people that are there today are caregivers. So they're also a big important, they have a big important role, I believe, in helping the people that have dementia. So that's very important to also take care of them. And they also suffer from a lot, like depression and anxiety. So this is also treatment that can help them. So now going to psilocybin. What is psilocybin? So very simple, that psilocybin is a substance that is coming from mushroom that certain mushroom that you find in the wild. And it's a psychoactive substance. And psychoactives meaning that it has an effect in your brain. So like ingesting those mushrooms are gonna have like an effect in your brain, and a positive effect. We can talk a lot about psychedelic, and I don't want to do it too much today about things that people or like believes that, for example, that psilocybin like that is addictive. That's one thing. Psilocybin is not addictive. Psilocybin is like one substance, very safe and administered in the right condition. So I don't suggest that you use psilocybin by yourself. I suggest that you use psilocybin with someone that is experienced and that have the knowledge to, so with a facilitator. So it's a, and also there is 2 ways to take psilocybin, or you can take psilocybin macrodosing or microdosing. For the condition, for every condition, I recommend macrodosing. So macrodosing definitely required to have someone that is facilitating the process. So someone alongside. Yeah, so yeah, I have lots of things to share, so I'm going to go more on it. So what the mechanism action, it's basically like after ingested, it goes from your gut to your brain and plays like it's touched the serotonin receptors, and the principal action is like neuroplasticity, neurogenesis, modified the brain connectivity, have an action on the default mode network and enhance emotional processing, neurochemical changes, and psychological insight. We're going to go back on all this later, that, you know, the benefit. So that's the benefit. So what is neuroplasticity? So psilocybin is going to stimulate neurogenesis and neuroplasticity. This is the capacity of recreating inside your brain new neurons and new neural pathway. So it reorganized, like, you know, your brain in a different way, and just stimulate the activity in your brain. And so it's a important factor that, you know, recreating new neuron and recreating like strong activity. I'll show you a drawing later. And also that it's reduced the inflammation inside the brain that is often related to stress and dementia. For the caregiver and for the people is like related to lots of stress. So it has also an action of different a substance like a neurotransmitter in the brain and reduce the inflammation. And what we want and what is it good for is like delaying the progression of the dementia. So yeah, reducing stress and definitely that reduce, and that we have lots of studies that are easy to find now about depression and anxiety, and this is like would be like the major symptoms that we're going to try to treat with psilocybin. Sorry. So yeah, so you and I hope that you can have the slide to see it better, that because like a drawing is like much more than words. Like, I know you can see that the neuroinflammation, what the on the side, what sorry, dementia does to the brain, and how like psilocybin can help on the other side. So the anti-inflammation, and if you have less inflammation, it helps. Like inflammation basically is a neurotoxic, and that's what, you know, the more your brain is going to be relaxed, and the more it's going to be able to like enhance the neuroplasticity and neurogenesis, and that, you know, you're going to be able to think more clearly, and so that's why it's going to help you. You see that when you're stressed, you can't function a lot, that, you know, it's just like impairing like functioning. So this is what we see. So that's how like psilocybin can help, that calming brain and having an effect on the chemicals that is creating that all the stress in your brain, like norepinephrine and the like chemical like this. So yeah, so you see the creativity, the connective flexibility, and it also emotional face recognition, because it's helped, and we're gonna see, and so lower down depression and anxiety. And it's basically, when we're saying this, is stress. It has a big impact on stress. And so I love this image. It's a very well-known image, and to understand that how psilocybin and what psilocybin does. It's you can see on this is like a representation of a brain, and how a brain and the connection in between different part of your brain and a normal brain. And I'm not like a neuroscientist, but what I think is that, like, what it happened in somebody that have dementia, this, like, probably the connection is becoming less. And so and in the different part of the brain. So what psilocybin does, and there is someone that I love it, that is explaining it, like, those bowl with like snowflakes inside, and that you shaking the snowflakes, and that's a bit what psilocybin is doing in the brain. That suddenly that you taking psilocybin and you have all those like snowflakes like moving everywhere, and this is like the connection in different part of your brain. And we've seen that like certain part of your brain that are never connecting with each other. So it's create lots of new neural pathway, lots of new connection in your brain. So it enhances that what dementia is like kind of destroying. Yeah. Yeah, so I'm now going to talk about sophrology. That is part of my protocol, because I think it's important that I believe that psilocybin, take it by itself, as it's not better than taking with like therapy and with like sophrology, because sophrology is also part of my protocol, and it help people. It's work a little bit like and also relaxing. And this is a practice. It's a somatic practice, and it's everybody knows mindfulness. And it's a practice very similar as mindfulness, but it's a bit more developed. But it has been created at the same time in the 60s by a neuropsychiatrist. And it has more tools than mindfulness, but it works the same way. So that's dynamic guided meditation. And so it helps in different way, like one is to, one more time, relax. And also for people that have dementia, it also helps them to reconnect with their body, the body awareness. Sometimes people, like, they don't have like completely, they lose a bit the connection with like their full body awareness. So basically, the protocol that I offer is really to helping people reconnect body, mind, and soul. And sophrology help with the psilocybin to reconnect. So, and it's also that, although that it's a technique that you can practice alone, without that you can learn and practice alone. And we'll go back after why also it's important. Yeah, and also very important for caregivers, because it's help alleviate stress and help also to help the people to deal with people that have dementia. So I'm already at the conclusion, because I was wanting to give like lots of time for questions, because I like interaction.
You did a good job, though. I think you did a great job of
okay, thank you. So I want to go back to the benefit, and so that psilocybin will have like help with like body, mind, and soul, that that the memory, the overall function of the brain. And when I say the mood, this is talking about not only that everyday mood, but also, yeah, the depression and anxiety for both. And I'm talking about ethics because something is important. We saying that it's very important to deal with the issue as soon as possible. And with psilocybin, the ethics will not allow anyone to give psilocybin to someone that is not fully engaging and knowing and understanding what they are going through. So this is not a medication that you can give to someone and without his full consent. And so this is like for people that at the beginning that still are
Yes.
very conscious, that is that, you know, ethically, this is a no to give psilocybin to someone that is not 100% engaged in the treatment and aware, conscious of what it is. That is not the case. Like, you know, with sophrology, it's more like, you know, it's different, that it's more appropriate to like any time for
Any stage of the
yeah, any
disease.
stage. Thank you. Yeah,
So I'm gonna
yeah.
thank you for your talk, Benedict.
Thank you.
Ladies, and there are some questions in the chat, and I want to circle back on that. Sheryl, I'm conscious we're right up on your time. I'm gonna just ask you to have just a little bit of patience with us. I'm sorry about this, but Benedict's talk, I think it was very important for people to understand the process. That so when we participate in something with psilocybin, it's important to have the guidance with it. And then it's also important that you understand, because this somatic work, which is, I use that a lot as a physiotherapist as well. I think it's a very important thing, which is sort of connecting your mind, your body, breathing in harmony with movement and so on, so that you begin to ground yourself back down into your body in a very particular way. I'd use somatic work myself, just to alter muscular patterns that I have and that some of my clients have, that are related to things like just being in survival mode all the time, this increased tension. I hope everybody heard Benedicte when she spoke about the fact that this is not something to do on someone who cannot give their consent. So psilocybin, it's psilocybin, right? I'm sorry.
Psilocybin, yeah.
I always get it mixed up, and I want to add in bisin again or something like that. Please forgive me. Psilocybin is not something that is something that you're going to do on an advanced or a stage 7 dementia. It is useful for like mild cognitive impairment, and if the person is like in the early stages where they can understand and give consent. I think it's important to look at this as caregivers as well, because oftentimes when we come to caregive, we also need to process many things that we are struggling with or dealing with ourselves. And a lot of these issues can also stem from childhood traumas or childhood experiences that we had, and we might not even be aware of it. So I think, Benedict, just as Donna said, a lot of these talks today are about, you can use this as a caregiver, and then it can also be applied for the person living with dementia, because it's important to know. So someone had asked a couple of things. Let me run right back. Kay Brown had said both CST and psilocybin seem to result in similar outcomes. How does one make a decision about that? That would be it. Is the person early? Is the person early enough to give consent to do psilocybin, right? And if they are, then I would tell you to go ahead and try it out. Decreasing inflammation in the brain, because it's also important to say that not everyone who presents as a dementia, especially if they haven't had a diagnosis, is a dementia, right? Sometimes you may have other conditions that are driving a lot of inflammation in the brain, and decreasing the inflammation is going to improve the connections, right? So I think it is something that you can explore. CST, which is cognitive stimulating therapy, is more about us participating in activities together and that carries into moderate dementia that stimulate the person and sort of allow them to participate, to sort of stimulate them by allowing them to participate more in activities. So two very different interventions, but as I said, I think the differentiator there would be, I think it's worth looking at, which is why I have it here. I think it's worth considering psychedelics, both for early dementias and for the caregivers. And I would encourage you to get in touch with Benedicte and explore that. Okay. Benedicte.
Sorry, you know what I believe always, it's that, you know, even for always like the I think there was Donna was saying this, the more you add up like different thing, it's not bad to combine everything
As well,
because it's just helping,
there's that
it's
as well.
just going to help more and more to stimulate the
Yes.
brain, and that's what we want. So
No,
you
and
can,
right,
I
and
believe
that's
you can.
important as well. Yes.
Mm,
No, you're right. You're right. And you can do them in combination. There's nothing that says that you can't
exactly. Yeah.
do both.
Yeah.
Leslie G, who has, thank you, Leslie. Sorry, Leslie's comment came in at the end of my presentation when I was into Benedicte already. And she was saying, oh, you know, it's about, they do have ICST and so on. Yes, they do. It is, I became aware of that coming into the end of my master's and when we were doing research for it. As I said, the things with CST are one, it requires cultural adaptation for you to deploy it in the Caribbean effectively. But it is also, and it needs to be said, I see you've mentioned Mr. Orell, who is another very, very prestigious dementia researcher as well, and someone that I read a lot of his research. So the cultural adaptation is one. And secondly, it needs to be said that CST is not only in use for dementia, I use it also with strokes and head injuries, and it does have a lot of applications outside of dementia. But because we're talking about dementia today, that's why I've narrowed it down to that. CST is a fantastic thing. Benedicte has stuck her contact information back in the chat for those of you who want it. I've seen, and I would encourage everybody to get in touch and have that discussion with her. Don't feel limited as if you can't, you can always talk to her and say, well, this is where I'm at. Do you think this is something that's appropriate? Martin Orell, yes, Dr. Martin Orell, he's another fantastic researcher. So I'm really happy to have you here as well, Leslie G. There's another question in here that I wanted to do. No, I think I've covered it. Yes, and she was saying, you see these benefits. So Shoba is talking about the benefits of yoga and meditation. Yes, absolutely. I would say with dementia, however, it's a bit different. Why I'm so interested is with the psilocybin as well is because sometimes dementia comes with a lot of physical restrictions. So while you can do yoga up to a certain point and all movement is beneficial in dementia, I think that somatic approach it really has a lot of value. So everybody, Benedicte stuff is in the chat. Please look at it. If you can't reach it right now, that's fine. Feel free to reach out to me and I will be happy to pass it on to you. So don't, if you don't get it right now, don't be upset. You can always reach out to me and I will be more than happy to pass on anyone who is here today's information because they're all fantastic. That's why I have them here. And I think, everything here is worth exploring further with the individual. So now, 9 minutes late, please forgive me, Sheryl. Sheryl Garriques-Lloyd is a lecturer at the UWI School.
Sorry, can I add something?
Go
Because
ahead.
I see in the chat where you get psilocybin or psyllium. I don't know if that I recommend one more time that there is microdosing and macrodosing. Microdosing is when you're taking a little bit of it.
Yeah.
And, you know, I definitely, for the condition and for this condition, I recommend macrodosing. That, you
Yes.
know, if you really want to have an impact and an effect, that, yeah. So, sorry. Thank you very much.
Thank you. Thanks for clearing that up. But also, as I said, I would tell anyone who is new to this, do it with some supervision first. So do it with someone like Benedicte, and then so that you have a better understanding of it, before you try to do it on your own. I would suggest that. And she did say that in the presentation. So really do take that in consideration. You can have some, you know, some things can happen when you're under the influence of a psychedelic, that it's best to have that experience with guidance from an experienced person. That would be my 5 cents on it. So we're introducing Sheryl Garriques-Lloyd, a friend of mine for a very long time. She's a lecturer at the UWI School of Nursing in Kingston, Jamaica. And she has over 15 years of clinical nursing practice prior to her transition to nursing education. A registered nurse by profession, Sheryl holds qualifications in psychiatric nursing and nursing administration and a master's in nursing education. And she is currently pursuing a PhD in mental health at Lancaster University. Passionate about mental health, Sheryl has conducted research and presented regionally and internationally, and has also launched a mental health blog with her colleagues in 2021. Mrs. Garriques-Lloyd is also the regional coordinator of the Latin American Caribbean region of Sigma Theta Tau International Honor Society of Nursing, and she is actively involved in various local, regional, and international nursing organizations. She also makes time to be a mentor at the Women's Center of Jamaica Foundation and is actively involved in her church. However, she considers being a wife and a mother to 5 children and a recent grandmother to her beautiful granddaughter to be her most rewarding life experience so far. So please welcome Sheryl Garriques-Lloyd. Sheryl, I feel breathless just listening to you, just introducing you. That's quite.
It's not that much, Debbie. Thank you.
I feel breathless just introducing her. But guys, this is one of the talks that I really want everyone to pay attention to, because I talk about this with my caregivers all the time. 1 second, Sheryl, let me just double check. I see Teresita's hand is raised. Teresita, did you raise your hand, or was this from before? I think it might be from before. Okay, Sheryl. Sorry about that.
I did not raise my hand.
You had raised your hand again?
No.
Okay, wonderful. Sorry about that, sister. All right,
That's all
Sheryl,
right.
go ahead.
That's all right. Thank you very much, Debbie. Good morning, everyone. Thank you for joining us. I'm very proud of Debbie for having these dementia talks. It's my first one, and she knows that if you break down all of what she breathlessly said, it's only about mental health, and maybe the fact that I love purpose. So her background is perfect. So I want to talk to the caregivers, whether you are a professional caregiver or it's the family members. My all-encompassing phrase is that there's no good health without good mental health. And so I just wanted to share today a little bit about how we ensure we are caregiving, not just those we care for, but also ourselves. So we're going to just talk a little bit about these definitions: caregiver mental health and caregiver burnout. What are the signs and symptoms we should be looking for as caregivers if we're heading to burnout? What are some tips we can use to care for ourselves? And then the bottom line is, as Debbie would say, go out and use it some more, or start using it and or reinforcing it and sharing it with somebody else. So a caregiver, whether you paid or not, you really provide assistance in meeting what are the daily needs of another person. And when we're looking at dementia, for instance, it may range from bathing, dressing, having to drive them about, taking them to their doctor's appointments, giving them their medication, preparing meals. And of course, if you go for the visits, you may have to communicate with the healthcare staff who will be caring for them. The question, though, is usually who will care for the caregiver, because we have a saying, you can't pour from an empty cup. And unfortunately, when we care for somebody, persons in general, but especially with dementia, it's a very long, stressful, and intensely emotional journey. And it's one that runs the risk of being all-consuming, because as they progress, you find yourself having to do everything. So the burden that we pay, it can increase the risk of significant health problems. And caregivers of persons with dementia have reported experiencing depression, high levels of stress, and burnout. And at some point, the studies reflect that all persons who have cared for persons living with dementia have reported sadness, anxiety, loneliness, and exhaustion. So the final sentence on this page says, seeking help and support, it's not a luxury, it's an absolute necessity. Caregiver burnout is when we've exhausted all the options. We've passed exhaustion, actually. And so we're in a complete state of physical, emotional, and mental exhaustion. We are dedicating our time and our energy to managing the health and safety of someone else, usually at the expense of our own. So caregiver burnout will impact us in many ways. So physically, we just don't have any more. Psychologically, we're not doing well. Financially, it drained us. And socially, we can feel isolated because all of our time is taken up with giving care. Pretty much it feels like when the candle has run out of the wick and or your lamp, you don't have anything more to give, really. We've run out of, when you have gas, men who drive probably tell you when they get to eat, they still could make it to the gas station. Women are not like that. When we get to quarter tank, we panic and go fill up, right? But when you run out of gas and you're going on fumes, burnout is when even the fumes are done. So the studies show that about 60% of caregivers actually experience symptoms of burnout. So the list is exhaustive, but I tried to put on the screen the main ones that we've read about that are being experienced. So the burnout results in the emotional and physical exhaustion, because sometimes with dementia too, we have a lack of sleep. You have to still be awake even during the nights when you should be having that restorative sleep. Withdrawal from friends, family, and other loved ones, because we find, especially if it's a family member, when your time gets taken up, you feel as if you don't have the time to socialize. Loss of interest in the activities you enjoyed, having not done it for a while or having that your focus, you kind of lose an interest in it. You start to feel hopeless and helpless, and that's a combination of factors. The person who you're caring for, you're watching them not be the person who you knew before. You're starting to feel hopeless because maybe you need more help and you're not sure where that's going to go. You're not sure where all this money is going to come from. We can have changes in appetite or in weight. When we are feeling stressed, our appetite makes us stress eat and or we lose our appetite altogether. Changes in the sleep pattern can be related to the fact that we are not getting an opportunity to sleep while the person is awake during the nights, but it's also because we are exhausted and our circadian rhythm has completely changed in giving the care. However, sleep is important, so is rest. We have to restore our own minds. The inability to concentrate, and no, I don't mean for those of us who are getting older, when you go in the room and you don't remember what it is and you have to go back out and come back. Not like that necessarily, but a general inability to focus on, concentrate on things that you would have been able to do before. One of the things that comes with exhaustion from a physiological point of view is that we wear our immune systems out and we find ourselves getting medically unwell more often. And then we, of course, start to get to the point when our emotions are bubbling like a lovely little volcano. We get very irritable, we get very frustrated, and it gets expressed as anger, sometimes towards the person we're caring for and or to anybody else because we're just angry, so we displace it. If you come in my path, chances are I may just be very angry at you. I put the last sentence at the bottom in bold. If the resentment comes from the burnout towards the person you're caring for, you may feel like you want to hurt that person. This is the absolute time to reach out for professional psychological or psychiatric help immediately. You don't really want to do it, but it's the feeling. So that's something that requires us to reach out for help right away. So what can we do to adjust to the dementia diagnosis? And some of this will be for the family, some will be for somebody who's a professional caregiver. And the very first thing about mental health for any one of us in any situation is about flexibility and the ability to adapt. Without that, we are going to be in a serious up the river struggle like the salmon. No, we have to accept the dementia diagnosis. It's very difficult to accept, but it requires us to go through the emotions in order for us to get to the other side of being mentally healthy. Any emotions we are facing about any situation requires knowing it, naming it, and going through the process. So we need to give the person time to adjust, because the first thing when we hear dementia, all of us will be like, we're going to be losing more and more of ourselves. You're thinking the same thing, so is the person who has the diagnosis. So give yourselves the time to process and go through. The other thing about accepting the diagnosis, I would say, is leaving the past. As the dementia progresses, do not frustrate yourself and the person you're caring for with comparison of who they were before. It's important to accept them in the stages as they progress. So the more you focus on they used to be able to, the more frustrating it will be. So accepting the diagnosis is very important. We have to deal with the conflicting emotions. I just said we have to name it, we have to go through it and process it. So we're angry, why is this happening? Frustration and disbelief will go through denial. Grief is about any loss, and you also have what we call anticipatory grief. So you start to anticipate what's going to be happening. We get to fear, because how will you be able to manage? And so we encourage you, both of you, as you help your person you're caring for and yourself to go through these emotions. Start preparing for the road ahead. So we need some support. We all need support. I'm very aware that sometimes caregivers do not have a lot of support. We may be able to help them with their independence. We may be able to do some of the activities for ourselves and have them live by themselves or with us in the early stages. But we have to really be aware that as it progresses, it's more than likely going to mean they need help all the time. During the middle stages of dementia, it can't be done alone. For the persons who have to do it alone, I really wish for us, Debbie talks about the support group, reaching out to community members, even if you don't have family, it cannot be done by itself. So we have church, we have our neighborhoods, we have our friends, other families, we have volunteer organizations, and sometimes we really have to hire a professional caregiver because it's going to become too much. The structure and the familiarity, we try to do that as best we can in the middle stages. So try to keep the activities that they usually participate in similar. You know, breakfast at this time, having lunch at this time, maybe a little bit of television watching, if visitors come and so on, and a routine bedtime. And we ask for patience. If they're having a little difficulty, it's very easy for us to be annoyed and say, how much time do you going to ask me what this thing is? Just a matter of breathing and having a little bit of patience. The more annoyed we get, the more they are going to struggle. When we get to the late stages, this requires us, especially here, to plan for our own care. Do our annual checkups, pay attention to the things that are giving us burnout and are a stressor, and we need to address those. Relaxation techniques work, as we've heard from the presentation before mine, not just for the person with the dementia, but definitely for us. Prevention is better than cure. And the last one, I just had to point it out. It's very disheartening and distressing for caregivers, especially the family, but sometimes it gets down to 24-hour nursing care at home, or we actually have to move them into a nursing home. So how do we care for ourselves as the caregivers? The first thing is we have to manage our stress. So I don't have any exhaustive list in my presentation, but I just wanted to say to us, it's okay not to be okay. There's nothing wrong with that. It's okay to have the conflicting emotions. The important part is to acknowledge them, to work through them, and then to address what we can. So if we don't manage our stress, pretty much the stress is going to manage us. And so I just had 5 things over here. The staying in touch, even though we are busy and caught up in caring for person, it's very important to make sure we don't lose that social aspect, because it's also good for our own mental health. The sleep can be a little bit challenging, especially if they're not sleeping. Dementia can be like what we refer to as sundowner syndrome. So as night progresses, their disorientation gets worse, or their confusion, but we have to have a routine on how we can do this. So sometimes we have to go back to the basics for those who may have children. Your parents become like when you had a newborn, and maybe you and your spouse have to take turns. I will do the first 4 hours, you do the last 4. There has to be a way to factor in getting enough sleep. Brains need rest and recovery. That usually happens during rest and sleep. Give yourself credit. Some days you are not going to feel great. Some days you are going to feel like you're not doing a good job. But you wake up each day, you put the effort in, and they are still with you as you care for them. Just give yourself a little bit of credit. It's important to count every win, including the small one. So if they had 1 spoon of porridge yesterday, and you were very frustrated and you worked it out, and they have 2 spoons today, count it. Yes? There's going to be behavioral changes. We talked about the flexibility. You have to adapt to the changes as well. Instead of staying in the past, move forward with it and make the plan to adjust. And I don't use the word exercise. Sorry, Deb, sorry to Offniel. Exercise is a bad word in my vocabulary. I say physical activity, right? So we don't want to say exercise like going to the gym and things like that. We're talking about movement. There's yoga that we spoke about. There is stretching. There is walking in the spot. There's a little bit of dancing when you're cleaning the house. Just get some physical activity in. It really helps. As I tell my students all the time, I love Legally Blonde because Elwood said, the person who just exercised couldn't have killed anybody. Physical activity releases endorphins, which are feel-good hormones. It automatically releases your stress, makes you feel better. So what are some other tips? Because self-care is what we need to do to make sure we take care of ourselves, minds, bodies, and souls. We need to manage that well-being, reduce the stress. And I have a phrase I like that says, selfish isn't always a bad word. That's when it's called self-care. So although you're the caregiver and you are prioritizing somebody else, you need to prioritize yourself. So let's start with inside and outside. I just had a few here again. Healthy foods. We are what we eat. What you put inside you matters. Everybody knows every now and then we're going to probably have like 2 mangoes, Julie mangoes. Mango season coming up, and that will give you some energy, but that's like more simple sugar. So we're talking about eating more nutrient dense and so on foods to sustain you overall. And if you're caring and you're going to be sedentary, then we really don't want to have a lot of the fats and the sugars that will probably make you medically unwell. Make time for yourself. Me time is very important. Even if you have to go in the bathroom and lock the door for 15 minutes, or you have to turn the phone completely off, me time is very important. If you can't squeeze an hour in every day initially, start with 10 minutes, increase it to 15, then increase it to 20. Find a little bit of me time. Get some outside time if you can. It's important for the sunshine, to give you that space, to hear the wind blowing, to see the breeze. Some days we complain a lot, boy, Lord, it's raining. Then another day we say, boy, it's really hot. But whether or not, going outside and connecting with nature is important. Spirituality is important. Not everybody is religious. Some people are spiritual. Whichever one it is, what is it that works for you, that brings that kind of calm and peace to your soul? So devotions, prayers, meditations, mindfulness, just find time to do that. We talked about the physical activity. And I like to say to persons, you could have a gratitude journal or you could just have a gratitude jar. Get a jar with cheese whiz, peanut butter, wash it, empty it out, take the label off. Get a pack of Post-its. And every time there's something that reminds you that despite the struggles that are happening, because it is going to be a challenge and a struggle, I'm grateful because of this. Make a little note of it in your journal or drop it in your jar. When you're not feeling so great, pop them out the jar or open your journal and remind yourself of the fact that there are still good things happening. So I added some general self-care tips because sometimes we talk about self-care and we talk about stress management and the expensive things pop into our head. You know, let's get a massage and you say, boy, that's going to cost money. And you have to funnel that into the dementia care. Or you say, let's get a trip out of town. And you say, well, that's still going to cost money. Small goals are important for general self-care. 10 minutes to 30 minutes, at least one single thing every single day. Consistency is key. Medium-term goals, let's say once out of every month, you take a couple of hours, or maybe you get a half day. Let's say I'm in Kingston, let's talk about just going with your own food, going over to Hope Zoo and sitting on the grass. Then there's no charge for that. Long-term goals. If you are able to have somebody work with you for giving care, let's say, for instance, you plan and say within every quarter of the year, you may consider taking a whole day. So you take a Saturday or a Sunday, or you could actually squeeze that weekend in, or it could be simply be something fun like going to watch a play one evening. Just plan it ahead of time and you make those goals. So you need small ones every day, medium-term ones at least once a month, long-term ones, which could be every 3 to 4 months. And then over on the side, you will see small things. Take a long hot bath. Compliment yourselves. Remember, I talked earlier about giving grace. You know, go for a little walk and look outside. Drink more water. Hydration is very important. You don't need to volunteer here because you're already doing a lot. But if you have one little thing you could be involved in that makes you feel joyful, and you have somebody else to provide the care in the time you're away, then go right ahead and do it. Hugs are magic. The amount of endorphins and oxytocin that gets released when you get a hug, if you're the hugging kind and you have family members and friends to hug you, if you're a professional caregiver, when you go home, get those hugs in. Listen to the music, give yourself a break. Learn to say no is very important for self-care. The more you say yes to somebody else, the less time you have for yourself. I'm not saying to be selfish, but figure it out and find out what's the best thing that works for you. The one I usually have, sometimes I say to persons, is Epsom salt. Works magic. Your body will thank you, your skin, your feet. You have water at home, hot water. Boil some water, pour it in a pan, put some cold water to make it warm, put 2 spoons of Epsom salt in it, and soak your feet while you're having dinner, for instance. Amazing. Those are not things that cost. You know, if you like reading, read a book, and so on. Now, this one I'm sharing with you because we have those moments when we are most overwhelmed, and it feels like I cannot even make it out of this very moment. This is the one I want to share with you because we can use this one as often as we wish. In any moment, and the moment we are able to address what we're feeling, it gives us the opportunity to try and rationally think, then what next? So we use the STOP technique, and the STOP is an acronym because it literally means stop what you're doing, take some deep breaths, observe what's happening to you. Am I overwhelmed because I'm hungry? Do I need to use the bathroom? Do I need to scream? Do I need to go and just look outside for 5 seconds? And then when you get to pee, you need to proceed, but you need to address what you found at O. So that's stopping what you're doing right away. Just stop in the middle of what it is. Take a few deep breaths, observe what's happening to you, and proceed with addressing what's happening to you from O. The other picture on your right, it's on my right, maybe your left, is what you do for the breathing. We Jamaicans sometimes, or others, when we take a deep breath, a lot of us, human beings, we move and our chest goes up, but we didn't take the deep breath. The deep breath needs to come from in our abdomens. So the picture here is what I like to call the 3-3-5, deep breathing relaxation technique. So we inhale through our nose, we count to 3, we hold that breath for 3, and then we exhale through our mouths and we count to 5. Pretty much we are inhaling all that overwhelming stuff. We're holding it for a little, and the exhale through your mouth is slower because we're getting rid of it.
Sheryl, I want to practice that. Offniel, is it okay? I know we're a little bit behind. Would you give us some time, Offniel, please?
Yes, and I'm pretty much almost done.
Please, Offniel, because I know Offniel has other things scheduled, but if you
Right.
can
So this
just,
one is important. We
but
inhale.
can we do it together? Just walk us through that breathing exercise.
All right.
Everybody that's
So we're
watching.
gonna take the deep breaths.
So
If you're
let's
able
go,
to stand,
guys.
it's great. If you can't stand, then it still works if you're sitting. So we're inhaling through our noses, and we're not counting 1, 2, 3. We're counting 1, 2, 3. We hold it and count 1, 2, 3, and then the exhale comes through our mouth, and we count to 5. I'm gonna hold my fingers up if you can see them, and let's just do that at least one time. I usually recommend doing 3, and then we
That
move
is
on.
nice.
All right, so let's go.
Go for it.
Inhale through your nose, deep breath from your stomach, up. 1, 2, 3. 1, 2, 3. Exhale. 2, 3, 4, 5. For a lot of people, the very first time you exhale, you start to feel better already. So, in closing, I just want to say, sometimes, especially as family members, caregiving becomes a sudden task. If caregiving is even your profession, you run the risk of facing burnout. So that caregivers then must never forget that it's important to prioritize yourselves. It's an impossible task to caregive by yourself. Do not be afraid to ask for or to get help, because your mental health is your priority. And I love this quote by Katie Reed that says, self-care is giving the world the best of you instead of what's left of you. So in order to give care to your dementia relative or client, it's very important to make sure that you have what it is to give and to care. That's how you can find me. And there's no good health without good mental health. I'll take your questions or comments if there is maybe one hand or not, or I'll go to the chat so we can catch up with the time.
So I'm looking at the chat. Benedict, first of all, says the most important thing, which is congratulations to all of the hardworking caregivers. That I think needs to be said so often. She says congratulations to all of the incredible caregivers. That is something that needs to be said. From earlier, for anyone who was looking for Donna's product list and also her information on her senior care, I've stuck it in the chat. So you can just scroll up a little bit and see it. I put a comment to landmark it so you can see it. Hi, this is Christine Morris. I've only been able to get on now. Thanks for taking the time. I'm looking forward to the recording. Of course, of course. Whose information you want to say again, Arlene Henry Dawkins? Mine or Sheryl? Sheryl's is up. Sheryl, don't take yours down yet. Sheryl's contact information is up. Whose contact information you want to say again, Arlene Henry Dawkins? Let us know. And we'll put it up. Sheryl's info is up on the chat there. It's up on the screen there. You can get Sheryl at mentally-healthy-you@gmail.com. And her phone number would be 876-877-9933. And if this is all too much for you to take in right now, WhatsApp me on 876-829-8200, and I will give you all of Sheryl's information. She
They
is
just go to Instagram, Facebook, they'll find me at a mentally healthy.
and you can find her on Instagram and so on with a mentally healthy you. That is the platform that she uses when she's speaking about these things. Sheryl, I cannot thank you enough. That was a fantastic talk. I would say to you that as a physio, we know very well the difference between physical activity and exercise. Both are important, and you are correct that people do not need to always pressure themselves to say, well, it must be exercise, way of going to the gym and so on. World Health Organization itself has a lot of guidelines on what we call physical activity. And thank you for pointing out. So Dr. Brown Morgan is reminding me that Arlene Henry Dawkins is a family physician as well. So I'm so pleased to have so many of my family physicians in the chat. Anna Brown Morgan is one herself. So we recognize both Dr. Brown Morgan and Dr. Henry Dawkins for taking your time, because our GPs are super busy, for taking your time to be in here and to sort of continue to have this discussion with us about dementia in the Caribbean and in Jamaica. Thank you so much. I don't take it lightly that you're here and that you're displaying your interest. So I promise, and anybody who gets in touch with me or Dr. Henry Dawkins, I can probably just send Sheryl's contact info to you so that you can have it and you can reach out to her separately, okay? But thank you so much for being here, both of you. I've known Anna forever. I love her to bits and pieces. Not to plug and promote, but great GP. But we're also going to move on now to our final speaker, who has been extremely patient. I'm so proud to have him here. He's a fellow. We were both in the UK together. He's a fellow Chevening scholar, and I have so much. I want to say a soft spot. But it's more than a soft spot. I have so much deep admiration for this gentleman. Offniel Lamont is a physiotherapist and a sports medicine, exercise, and health specialist. His work spans injury prevention, rehabilitation, and healthcare policy. He has played a crucial role in expanding physiotherapy services at GC Foster College of Physical Education and Sport, pioneering a dedicated sports medicine clinic for high school athletes. And I can say, for one, that was sorely needed. And this is one of the reasons I admire Offniel, because he's been able to, get up all of these fantastic innovations that were long needed. He also serves as a physiotherapist for Netball's Jamaica Sunshine Girls and the Jamaica Basketball Association and Special Olympics Jamaica. You all tired yet? Offniel's public health advocacy extends to policy development regionally and nationally, ensuring better medical coverage for athletes and improved access to physiotherapy services. This was another big sore point for us in the region. He is an executive member of the Jamaica Physiotherapy Association and sits the Council of Professions Supplementary to Medicine, the regulatory body for physiotherapy in Jamaica. Sorry to give you that pause there. Offniel is also an accomplished writer with published articles on public health, physiotherapy, and sports medicine in leading Jamaican newspapers. I read him whenever he shares the articles with me, and they're fantastic. So please look out for him. His articles are very substantive. In academia, he has served as a lecturer and an external examiner. He is a Chevening Scholar, and he continues to make significant contributions to sports medicine, physiotherapy, and public health in Jamaica and the wider Caribbean. I can vouch for all of that. And he's someone I greatly admire. So everyone, please welcome Offniel Lamont, who is gonna give us his talk on physical exercise and activity in dementia. Offniel, it's all yours.
Hi, good afternoon, everyone. Thanks for having me on. I'm just trying to share my screen.
Yeah, because I'm seeing Offniel has started screen sharing.
It takes sometimes some.
That's
I'm trying
okay.
to get
You
into presenter.
had to wait on us, so we can wait on you. That's fine. There we go.
I'm using Canva, so it might take a while. Hopefully.
It's a lovely presentation, though. Very nice.
Got it. Okay, great. Let me just close that down. Let me know if you are seeing my slide.
I'm seeing it.
Okay.
But I'm also seeing your whole, no, I'm seeing the whole screen. So I'm seeing all the tabs you have open at the top as well. I don't know if you can full screen it in Canva.
Yeah, I can. Is that better?
No, still
No?
seeing the tabs at the top of the screen.
All right. Let me.
But you can go ahead like that if you want. But try, relax and try.
I just want to see, are you able to see my notes?
No.
Just the slide at the bottom.
Yes.
Okay, that's fine. Then that's fine. All right, then I'm gonna go right ahead. Thank you so much, Debra, for having me on and to speak with everyone that came on today. And I'm just gonna get right into it. So as expressed before, so this talk is to look at exercise prescription and dementia care, main topic, and then a subtitle is enhancing quality of life through movement. And I will get straight into it. Let me just move this around. So essentially, let me know, are you seeing my next slide as it?
No, you're still on your first slide.
Okay, that's good. I think. Oh, let me go back. All right. So when we talk about very interesting area, I think my screen is lagging. So very interesting area. But when we talk about dementia and exercise, we already know that in terms of from standpoint in terms of dementia, some statistics was mentioned earlier. When I did my research, didn't realize that it was such a very large, I know it's a big issue, but in terms of WHO research suggests that about 55 million people are living with dementia. This number is estimated to rise to approximately 139 million by 2050, which is a very huge number. And I found this particular statistic to be quite, I guess it contextualized the issue within the Caribbean region and certain countries like Jamaica, because over 60% of these persons live in low to middle income countries. And so certainly we have to pay special attention based on our geographic location. And then yearly, there are nearly 100 million cases, new cases every year. And Debra did a very good job at the overview as to the different types. I won't get in that. But I will move on, just to reiterate, it's a broad term describing a group of symptoms that affect memory, thinking, social ability severely enough to interfere with daily functioning. And earlier, Debra had told us that there are different types: Alzheimer's, vascular dementia, Lewy body dementia, and there's also frontotemporal dementia.
Offniel, I'm sorry. I have someone with their hand raised. I'm so sorry to interrupt you.
Okay.
Singh, is there something that you want to, because I see she has her hand raised. I'm not sure if she can't do it in the chat. Seni, is there something that you want to say? Can you unmute your mic and let us know? No? I'm asking her to unmute so that she can
Yeah.
share. No, not able to? Okay, sorry about that, Seni. Try and leave it in the chat so that we can get to it later. Go ahead, Offniel. Sorry about that.
Yeah, man, that's fine. Now, since I'm talking about dementia and physical activity, the effects, when we think about dementia, what are the effects does it has on physical or cognitive function? Now, there is potentially going to be cognitive decline, which affects memory loss, confusion, difficulty with problem solving, and language, all of which is very important when we talk about how can we interact with this person to get them to become more physically active, or even to move from just being physically active to exercising. And then there is also behavioral and psychological symptoms such as anxiety, depression, aggression, and apathy, all of which affects negatively or can negatively affect someone engaging in any form of physical activity or exercise. And then there's the physical impairments that are as a result of dementia, which is decline in motor skills. So we're talking about simple tasks such as probably feeding one or his or herself, reduced coordination that could be potentially reaching for the phone, simple as that. And then there's the increased risk of fall, which many persons, especially as we age, this becomes a problem. But can you imagine now having dementia on top of aging? It is even a greater issue that would need to be looked at. So when we think about physical activity really helps to maintain cognitive function by promoting neuroplasticity and improving brain blood flow. The research is quite extensive in terms of the impact of physical activity and brain function. And the research has suggested as much as about 20% can help in terms of delaying or improving brain activity and function.
Sorry to interrupt again. Offniel, are you progressing your slides? Because we're not seeing the slides moving.
Are you seeing effects on physical and cognitive
Yes, I'm just
function?
seeing the heading, exercise prescription and dementia care,
Oh.
enhancing quality of life through movement. So your first slide is what I'm seeing. I'm not seeing it progressing. I mean,
Ooh.
your talk is lovely. I'm following the talk, but I'm not seeing a progression in slides.
Let me stop sharing. I know
You
what
want
I'm
to
going to
send
do.
it to me and then let me just move it
Yeah,
around for you?
maybe
Just download
that.
it from Canva as a PowerPoint. Sorry guys for this technical thing. Just download from Canva as a PowerPoint and then just email it to me and I'll just get it up for you. So that it's because the talk what you're saying is really fantastic stuff. Just send it to me, home care, the number 4 JE, and I'll get it up for you. So that we can follow, because the talk itself is so substantive. Guys, I really apologize. Just give us a few minutes so that I can just see if I can get those slides going up for you so that you can follow along while Offniel is talking, because what he's saying is really, it's if you are a caregiver of someone with dementia or so on, it's really valuable information. And I would know it as a physiotherapist, but it's wonderful to hear him articulate it so well. So I want to give you the experience of also having the slides in addition, if we possibly can. So we'll just give it, maybe like 2 or 3 minutes. Just bear with me in patience while he downloads it and sends it off to me. And then I'll just share it. I'll just open it and share it for him so that it's easier.
It would be the same email that sent me the link, right? Just checking.
Yeah, home care, yeah. Home care for JA, yeah. So if you send it there or send it to any one of them and just tell me where you sent it and I'll get it up.
Okay, home care for JA. Right.
Mhm.
And then attachment. There's many things going on. One second.
Yeah, take your time.
Yeah.
Not sending? Maybe you want to close some of the windows on your screen because you had a lot of them open. That slows down the laptop a whole. That slows down your computer a lot too.
I'm just checking. How's it done? Let me go back and check.
You sent it to me?
No, I'm checking to see if it downloaded. Okay, it's taking a while.
Oh dear. I think you
Okay,
might
all
want to
right. The
close
first
some of the
one
windows on your PC.
is
But I
okay.
want you,
Okay.
you might have to continue because I don't want it to be too long a gap for the poor people listening. Please bear with us one more second because I would love you guys to have the stuff. But if it's taking too long, I won't I will
All right. It's gonna come as a PDF. Not even sure if that works. Can you show it as a PDF?
I can try. Let's give it a shot. So Karen Ford Warner, thank you for your very kind comments. Please take care and remember everyone that I would say by the weekend, this recording will be uploaded on my YouTube channel. So whatever you miss, you can find it on my YouTube channel, which is my name, Debra Callender. So once you search that, you'll find the recording up there so you can catch up on whatever you lost. I'm not seeing it, Offniel, but perhaps you should just continue so they can get the substance of it.
Okay. Okay. All right then. Let me do that. Okay, let me go back and share my screen. I sent it to you as a PDF, but you can see if
I'm waiting to see it in my mail, but here we go. All right. But go ahead in the meantime, and
okay.
I'll catch you up.
All right then. All right. So let's go again. Let me see. Yeah, so I was talking about, let me know if you're seeing this. You're seeing this screen.
Effects of physical and cognitive. The words just went away. Yeah, why is exercise important in dementia care? Yeah, we're seeing that stuff now. Effect on physical and cognitive function. Yeah.
Yeah.
Okay.
So I was saying, I think I'll just, yeah, so the physical impairments, declining motor skills, reduced coordination, increased risk of fall, right? And then when we talk about why exercise, I'm not sure why it's moving so fast. When we talk about why is exercise important in dementia care, it's because it helps to maintain cognitive function, as I said earlier, reduces risk of fall, improves mobility, supports mental well-being, reducing stress, anxiety, depression, of course, encourages social interaction and decreasing loneliness and isolation. And then key considerations when we're talking about exercise prescription within this population is that the first one is safety precautions, preventing falls, and of course, we emphasize supervision. And so one of the big things is that we encourage that exercise prescription is not just about, oh, I just take my relative and you find yourself in a gym somewhere without guided supervision from someone who is an expert at prescribing exercise for this population. Very, very important. So safety is a big thing. Personalization is also another big thing. What do we mean by personalization? It simply means that the individual comes to the practitioner who then does a detailed examination of the patient, or that could be the person you're caring for. And then based on that assessment, tailors a program for the needs of the individual or what you have also expressed that you'd like the person to do. That could be that you're currently, the person is unable to maybe do the donning and of their own clothes, or assist with some form of bed mobility or bed mobs. And a part of the goal might be to ensure that this person can maybe assist instead of being totally dependent on the caregiver. And so the plan would be personalized to not just the needs of the patient or to the relative, family relative, but also to your own needs, which is very important. And then the progression is a gradual intensity increase. So you don't start at 5 minutes, a 5-minute walk, and then week 2, we're somehow doing a 30-minute walk. The type of exercises needs to be a broad spectrum. So we're talking about aerobic, improving, that's to do with your lungs and your heart. And then we're talking about strength-based, balance, flexibility. And then, of course, we're looking at engagement. So we're talking about using music. Maybe someone loves to listen to reggae, when he was younger. And so, some form of familiarity using music to connect with the person's social interaction and familiar routines. And then I wanted to do a case study for us to see how all of this works. So let's say we have Mrs. Jane Doe, who is going to be our client. She's a 72-year-old woman with early stage Alzheimer's. Her history is that she has hypertension, mild arthritis, and she has had recent falls. So lifestyle, previously engaged in gardening and dancing, and the goals were to improve balance, maintain cognitive function, and enhance well-being. All right, so what could her program look like? So we're gonna go through that together so to get a feel of how this looks. Sorry, it's changing too quickly. Okay, so week 1 to week 2 is like our foundation phase, right? We're gonna look at aerobic, right? And so one of the big things is that literature has suggested is out of all the different elements of what an exercise program should look like, the research heavily favors an aerobic component, right, being most beneficial as it relates to improving, maintaining cognitive function, especially within the dementia population. So we are going to start off with 10 to 15 minutes of walking, and this is supervised. And then we are going to do, as it relates to targeting strength, chair squats, simply just sitting and standing, 2 sets of 8, and then seated leg lifts. So literally just sitting and just lifting our legs off the ground, right? 2 sets of 10 for each leg. And then for balance, we are proposing, or I'm proposing, heel to toe walking, right? That's simply just walking and putting one foot in front of the other, one foot in front of the other. And then single leg stance, that's about 15 seconds each, right? And then for cognitive engagement, which Debra spoke to earlier when she alluded to this new technique that she's purporting for us to take on within the region. I think this falls under it quite nicely. Naming objects during walking, right? So that could be that they're walking in the garden and you're asking them to just name whatever they're seeing, right? It could be the flowers, and she loved gardening before. So potentially we will put her in the garden to do the walking, and while she's walking, asking her to name whatever she's seen around her. And then flexibility, gentle stretching, right? So that is how the program would potentially look for 1 to 2 weeks. And of course, this would be supervised. Now, weeks 3 to 4 is where we're thinking about progression, right? So this is where we would move from 10 minutes of walking to 15 minutes of walking. And then we're including something else. We're going to do it with music, right? And along with that, as it relates to strength, instead of just doing the exercises body weight only, we're going to include resistance bands, right? And so we'll find, again, all of these things are being done, especially the strength work, are actually being done in sitting, right? Because we want to ensure that sitting balance is very good. And then once sitting balance, you notice the things that we're doing for balance specifically are focusing on standing balance. So we're trying to ensure that both standing and sitting balance, we're targeting both during the program. And then for cognitive engagement, simple dance routines, right? To ensure that we're stimulating the brain. And then again, flexibility, we can include the chair yoga or just some simple chair stretches. And then our final phase, because this program I've written for a 6-week period with the aim of reassessing, is functional and social integration. When we talk about aerobic, we're talking about at this phase, it is hope that this person can join a group walking group or a dance group session. And this ultimately can be at about 30 minutes in length. And then increasing our strength work in the chair from just 2 sets of 8 to now 2 sets of 12, right, with our resistance band. And then as it relates to balance, we're now moving from just standing, heel to toe and just standing in spot, single leg. So now we're standing on like a foam pad, or that could be a cushion within our couch, taking out that very nice flat piece, and the person could stand on with eyes open, with eyes closed, a little bit more challenging because now this is an uneven surface. And then moving from that into flexibility again, doing the yoga stretches and stretching, right? And then of course our cognitive engagement, which again, I've included some of what Debra said earlier, which is the memory-based games, right? All of that can form part of the exercise program. So for example, they're doing the game, and instead of sitting with a chair with a backrest, they can sit at the edge of the chair while doing the game. So you're making the activity not just a memory activity, but also muscle engagement happening in the core at the same time. And then the final thing, as it relates to additional exercise consideration in dementia care, is that individual preferences is very important. If a program is going to be successful, incorporating activities that the individual enjoy is very, very, very essential, right? Environmental adaptations, ensuring that the space is safe and it is familiar. So it's not putting the individual in a space that they have absolutely no clue about, but ensuring that the space is safe. So we'd have to ensure that all the sharp edges are maybe rounded, and maybe applying some of those fancy gadgets to ensure that tables and corners are retrofitted to be safe. Now, behavioral challenges, managing resistance and agitation is also a very big part of exercise prescription. We have something called relapse strategies that we have to also develop, right? What if there is pushback? What if the individual does not take on board what we're trying to do? Then within the program, there has to be built-in mechanisms to facilitate those things, working through with family relatives. That could mean that potentially the caregiver might have to be present if we find that the individual is only cooperative when in the presence of the caregiver. So those are some of the things that we have to discuss at length to ensure that the program is successful. And then long-term engagement, keeping routines consistent, which is why a program would need to be written not just for a week, but ensuring that it's written over a set period of time where everyone can follow and there is some level of consistency involved. And then my final conclusions is that safety guidelines and modifications, I can't stress it enough, monitoring fatigue and adjust intensity, because it can also be lost on some of us, or sometimes it can be lost, that they can get tired, right? And so it's very important to monitor fatigue, monitor the energy level. Very important. I work with stroke patients a lot, so I know a lot about, sometimes just how they respond. Just the voice alone tells you whether or not, the energy has gone significantly down. And so that is very important. Ensuring hydration and proper footwear is also ideal if we're talking about engaging in physical activity or exercise. Modifying exercises based on progression is very important. And of course, encouraging, as you can see, the young man is running with I'm assuming, let's say his mother.
With his
Encourage
with his person. With his person. He's running with his person.
Involvement.
Running with his person.
And then my final slide, my recommendations and summary. Regular exercise supports cognitive health, mobility, and emotional well-being. There is so much data around just emphasizing, how good physical activity is for our cognitive health. Caregivers play a key role in ensuring adherence and motivation to programs when they're written. And once you have engaged and you're seeking to have your relatives or friends becoming more active as they go through dementia. Exercise should be tailored, engaging, and progressively adapted, right? I can say that again. Exercise should be tailored, engaging, and progressively adapted. And then movement is key to maintaining quality of life in dementia care. And so a lack of movement equals to a decrease in quality of life. And then I guess that should be it for me and my
Where's
references.
your contact information?
And I tried. I think it's on my last slide. It's at the
Thank
bottom.
you. Offniel Lamont.
I don't have a lot of fancy stuff.
No, that's fine.
You.
offniellamont@gmail.com. Let me just say, please note the spelling of his name, because I tend to spell Neil N-E-I-L. Offniel is actually N-I-E-L. So it's Offniel, O-F-F-N-I-E-L, Lamont@gmail.com. And you can, please remember that he is a full-time lecturer and has many, many responsibilities. But please message Offniel. Thank you so much. Can I ask you to go back 2 slides for me, Offniel, in your presentation, if you can?
Yeah, no problem.
Before I take questions, because there's some questions in the chat. Right. So is it this one? Yes, it is this one. So I think it's important to, is it this one where you say, yes. So the caregiver involvement, that's Offniel. This is just a fantastic presentation. And I feel now everybody can see. Christine is like, I'm gonna ask Offniel if he does home visits, but you reminded him, he does home visits, he does home visits, so let me block it. So he does home visits for sure. So now I hope that everybody can see why, as a physiotherapist, I ended up with a master's in dementia, because it does occur to you that for these people are a special population, and they do require a certain amount of thought and sort of focus in how it is that we build programming for them. Fatigue is a feature of dementia itself. So they don't always, you have to work with them in the way that that works for them. And he's also mentioned about the challenging behaviors and the resistance and so on. Which that's an important thing to bear in mind, because I can hear everybody going, oh yeah, he can say this, but you know, when you're there with them, etc. But if they are in a familiar environment is one, I can't say enough, which is why I see dementias at home, and I encourage, you know, most practitioners, if you can, it's not always practical to see them at home. It's a familiar space already. And you can build relationship with the dementia with the person living with dementia, once they don't begin to identify you as a person who is coming to do something unpleasant, right? So Donna had asked up in the chat here, let me just skip back a bit. She says, how can you adjust the program if the person refuses to do one or more of the 5 activities listed? Example, she does not want to do balance or strength. So before Offniel even starts, let me just say that this is the value of a physical therapist. And it's because a physical therapist can modify the activity to some, because oftentimes people will refuse to do things, and not just dementias, you know, any sorts of brain injury. And frankly, most people will refuse to do things if they're too difficult to do, or if it's really, really unfamiliar. So you might have to, especially with things like balance, which is, I know a lot of older people just passionately hate weights. Like I've had to learn to work in like resistance band and water bottles and all sorts of things to introduce the idea of resistance weights to them. And then also for things like balance, as I said, if they're terrified, you might have to start out, you know, small. And there are many ways to skin a cat with both balance and both balance and strength work. But I would also say that it's really important with a dementia particularly to sometimes give way, right? So if the person is really, really, you know, just hell-bent today on not doing it, sometimes you might have to just sort of do what you can do with them, as opposed to sort of trying to insist too much, which might lead to unpleasantness. But Offniel, sorry, please go ahead. I just wanted to get that stuff in, because I think you did such a fantastic job of really differentiating this population. And I really thank you for it, because this is not a talk I wanted to do myself as a physiotherapist in dementia care. I really want someone else, I really want them to see that other physiotherapists also can, you know, are capable of this management and the thought behind a management process for dementia. So it's not always just, yes, any physical activity is better than none. And we will also say for any kind of agitation, you want where people are expressing a lot of agitation and maybe a bit of aggression and stuff. It's even if you can get them walking or whatever, because physical activity can certainly help to manage a lot of that. There's a wealth of research. Exercise is the best justified intervention for dementia. It is the best justified intervention for dementia. But again, it has to be prescribed. So not saying that you cannot just walk your person living with dementia to the corner, but really just give some thought to having a specialist do it. Sorry, Offniel, I've said way too much, but give your thoughts on how can you adjust the program for the person who is refusing. You know, I talk a lot. Give your thoughts.
Well,
give your thoughts on that.
well, certainly, I want to agree with you in terms of, you know, every single time, you know, when you go back and you read copious amounts of literature and just evidence on, you know, what are the first choice care, you know, treatments, certain conditions should, you know, in terms of, and I do agree that exercise is definitely one that should always be considered. Unfortunately, you know, in our population, it's not always considered as something that should be done. Around whether or not an individual, as Debra said earlier, one of the good things is that we are trained to deal with circumstances like those, right? Even I work with athletes primarily during the day. And even they don't really want to do a lot of the stuff that I prescribe,
Right?
right? And you have to find interesting ways to, okay, fine, you hate that. Let me change it. And so you go back and you think about, okay, they prefer to do it this way. And then essentially we create our own exercises a lot of times to accomplish the goal that we had initially set out. So I guess a big part of it is being flexible to say that, oh, we might not be able to do it in standing, but I could make something in sitting way more difficult for the person, right? So it is to work around finding activities that they enjoy and then probably increasing the difficulty of those activities. So it could be that the individual really loves to sit and watch television, and I'm going to use that time as an activity time while they're watching, right? So if I am able to get them to do 20 hand lifts while they watch their favorite sitcom, that is a win in itself. So the consultation is to work through all of those to ensure that we come up with the best plan or program that will be successful. So it's not necessary to meet
That's
all of my
individual.
own targets,
Mhm,
but it is to
mhm.
ensure that it is successful.
Yes.
And then we're treading in the right direction.
Right, because what we do as physiotherapists is individualized prescription. So, you know, a lot of the time people will, but we have to take, so I have to know who you are, which is, it's also very similar in dementia care. I have to know who you are, what your medications are, what your best time at, if we're doing neurological work, what your best time of day is and all of that sort of stuff, so that we can, you know, we can take all of that into consideration and make something for you, because what Offniel can do and what works for him isn't gonna work for, I work also a lot with it, so I work almost exclusively with neurology and geriatrics, so older people palliative care and neurology, which is head injuries, etc., and then I have dementia care as well. So in all of those populations, you have to really take it, you know, to get all of the detail on who that person is. Because if you, what we all know as physiotherapists is they're not gonna do it if they don't want to do it and they don't really like it, they're not gonna do it. We are also trained to persuade and to work around, you know, so that because we have the ability to adjust programming. That is why, as I said, I'm so proud to be a physical therapist, because we have a really very powerful sort of gift to deliver in terms of the management of people, both with dementia, any sort of neurological condition, any kind of condition, because as he says, he works with athletes in the day, really. I always say everybody's life is better if physiotherapy can improve the quality of everybody's life. I always say that. So thank you so much, Offniel. You have, I mean, fantastic. I feel so encouraged by that presentation. I think we need to run a course now for physiotherapists, because I get a lot of lack of confidence around managing dementias. And I manage dementias. I am a
Yeah.
physiotherapist, but that doesn't mean that another physiotherapist cannot manage and cannot manage effectively. So I thank you for that. I think we probably need to run a course just to get our profession's confidence up on it. I want to thank, oh, sorry, are there any more questions before I jump into the thanks? I've seen a lot of thank yous for all of the information and stuff. Thank you guys for being here, for supporting Dementia Caribbean. This is our 4th staging. We hope to have a 5th staging in September. We'll see how it goes. I'm trying to keep it going as twice a year to raise awareness. I thank every single person who came. Every time I do Dementia Caribbean, we have, you know, I'm inspired and I get new ideas and I get new input and new projects and so on. Hi, Roche. Roche McLean Parchment, another physiotherapist is in here. I'm happy that you're able to make it, especially because Roche also manages quite a few dementias. So I'm very, very happy that you were able to make it. Everyone, take Shoba. You're welcome. Helene, it's our pleasure. I want to thank all of our speakers, Benedicte, Mannix. I think of Benedicte as Ben. Right, so Ben, Mannix, Donna, Singh, Sheryl, Garriques-Lloyd, Offniel, Lamont. Thank you so much for your generosity. These speakers speak for no cost. They come and they share their knowledge for absolutely free. So their generosity and their wisdom, I'm super grateful for it. It is nothing if no one comes to watch it. So thank you for all of the participants who have passed through today. Please remember that you can catch the replays and the full summary on YouTube, on my YouTube channel, Debra Callender. And you can always reach out to me if you need to get in touch with one of the speakers. I'm happy to facilitate that. So if you didn't catch their contact information, which I hope you did, you can always reach out to me, 876-829-8200. I'm happy to connect everyone as much as I can. So it's been, quite a trip from 10 o'clock until now. I think we landed the plane close to the time that we should have landed it. So thank you all for participating. I cannot say how grateful I am to my speakers. I have to bow to all of you. Thank you so much. All of the participants, I'm going to sign off now. This is the end of part 4 of Dementia Caribbean. Thank everybody who came. I don't see any more questions in the chat, so I'm going to sign off for everyone. And remember, as I said, reach out to us if you need us. Speakers, have a good evening. Thank you so much for being a part of this. 1 second before we go. I'm just looking at 2 more things in the chat here. Oh, I think Wendy has left already though. I don't know. Benedicte, are you still with us? Because I think Ben was supposed to leave, so I'm not sure if she's still here. Wendy, if you're still here, I'll answer that question about lands mean separately. And that was the only additional question. So everybody, bye-bye. Thanks so much. Take care. And we'll see you hopefully in September when we do part 5. Take care of yourselves.